Hi, I'm Dr. Lisa Peters, and today I want to talk about a hot topic I've been hearing around town, and that is en bloc capsulectomy. Let me start by explaining what that means. So whenever a person has any sort of implant placed in the body's natural reaction is to develop a rim of scar tissue around that implant, and that's called a capsule. So in the case of breast implants, when an implant is placed in a woman's body, she develops a capsule around that implant. And the concept is it's the body's mechanism for walling off that foreign material from the rest of its tissues. That's a normal process. Some women want their implants removed, and sometimes that removal of the implant includes removal of the scar tissue rim, the capsule around that implant. When that's done as one unit, when that capsule is removed with the implant inside it, the medical term for that is an en bloc capsulectomy. And that is a procedure that those of us who do breast implant surgery do in our practices. There are a few reasons to do that procedure, but let me emphasize that not every woman who's having her breast implants removed has to have that procedure done. That procedure is beneficial in a few circumstances. The most common would be if there's overgrowth of scar tissue around an implant, and that's called a capsular contracture. So if a woman's implant feels too firm or looks too perky, then typically we remove the scar tissue around the implant when we're changing her to a new implant to lower the risk that she'll develop recurrent capsular contracture. The second reason we may do that is if the implant is broken, specifically a silicone implant, because when a silicone implant leaks, the body doesn't absorb the silicone. The silicone usually stays within that rim of scar tissue, and so in order to keep that broken silicone contained, we usually remove the implant with that scar tissue, an en bloc capsulectomy, as one unit. A much less common reason to do an en bloc capsulectomy is if we're worried about this new illness that we're hearing about, ALCL, anaplastic large cell lymphoma. Very rare, only 414 cases to date identified and reported to the FDA. Very rare. And so most women wouldn't fall into that category. Just to explain, let's talk about what a capsulectomy looks like. So if my assistant here can focus on my screen here, this is a picture of breast implants removed in the en bloc technique with their rim of overlying scar tissue. And you can see this one looks kind of circular, this one looks like an implant shouldn't. Triangular is not a good shape for the breast. And this particular patient had capsular contracture. That's why her implant capsule is distorted. After I removed these from the body, I opened them up, and here's the picture of her implant. So on this side, her implant was normal. This side, you can see right there, there was a little bit of leaking of her silicone from her implant. And that may be why she developed capsular contracture, though we'll never really know. So when a person has a capsulectomy, she could choose a number of different things. She could choose to have her implant left out. She could choose to have her implant replaced. Sometimes a breast lift is beneficial. Sometimes, if the natural breast tissue has grown over the years, a woman might even have a breast reduction. And all of those are possibilities after implant removal. The best option for a woman considering implant removal and en bloc capsulectomy would be to come talk to your plastic surgeon, discuss what your concerns are, and determine whether this procedure is right for you. Certainly, if you have any questions or you want to schedule an appointment to see me, our office number is 708-524-1400, or you can find us online at plasticsurgeryofchicago.com.